conditions of the vagina. First of which is clear cell adenocarcinoma. Clear cell adenocarcinoma of vagina. This clear cell adenocarcinoma is a complication. Of a condition known as adenosis. So to have an idea of clear cell carcinoma or clear cell adenocarcinoma of vagina, we should have the knowledge of adenosis. What is adenosis basically? Adenosis is nothing but persistence of columnar epithelium. Persistence of columnar epithelium in the upper 1/3 of vagina. Adenosis is defined as the persistence of columnar epithelium in the upper 1/3 of vagina. Normally the vagina is lined by which epithelium? Any idea, please?
Squamous.
Normally vagina is lined by stratified squamous non-keratinized epithelium. Normal epithelium is lined by stratified squamous stratified squamous non-keratinized epithelium. But how it develops? So to have an idea of this, we'll go towards our embryology. The vagina basically is developed from two structures. Number one is Mullerian duct. And the second one is urogenital sinus. Vagina develops from Mullerian duct and urogenital sinus. Mullerian duct give rise to upper 1/3 of the vagina. Mullerian duct give rise to upper 1/3 of vagina, whereas urogenital sinus give rise to lower 2/3 of vagina. So if this is our vaginal canal, the upper 1/3 of vagina is developed from Mullerian duct. This upper 1/3 is developed from Mullerian duct, and the lower 2/3 develops from urogenital sinus. So that during the development, the upper 1/3 region is lined by which epithelium? Columnar epithelium. Upper 1/3 is lined by columnar epithelium, and the lower 1/3 is lined by lower 2/3 is lined by stratified squamous epithelium. So okay. Upper 1/3 of the vagina is lined by columnar epithelium, and the lower 2/3 is lined by stratified squamous epithelium during the development. During development, what happens is that this squamous epithelium also grows over this upper 1/3 region. This squamous epithelium also grows toward this upper 1/3 region, so that a female will have stratified squamous non-keratinized epithelium of her vagina throughout. Okay, but here is what our pathology begins. In 1970 there were some trials. Some females were given a drug known as diethylstilbestrol. This drug was given to the females who were feared for abortion. Diethylstilbestrol, in those females who were given this drug, diethylstilbestrol, in this area there was persistence of columnar epithelium. In females who were given diethylstilbestrol, there was persistence of columnar epithelium in the upper 1/3 of vagina, and this lesion is known as adenosis. This lesion is known as adenosis. And how it presents? It presents as columnar epithelium with morphology of some microcystic fluid-filled vacuoles. Means that this columnar epithelium is basically glandular in nature. So, as in adenosis, there is columnar epithelium. So, along with columnar epithelium, you can appreciate these microcystic fluid-filled vacuoles. Now, if a female is having adenosis, this adenosis can complicate to what basically our topic is. This adenosis can complicate to clear cell adenocarcinoma. And why adenocarcinoma? Because of this. Why adenocarcinoma? When will be a carcinoma called adenocarcinoma? Because it has a shape which is similar to the gland. Because of its shape, it is similar to because of its nature, that is glandular in nature. As it is glandular in nature, it is known as clear cell